respiratory response. And for example, after kidney surgeries, I have most of cases after surgeries that the orthopedic is sometimes in doubt if it has a CRPS or not. It's just you must do the cold stress test, because if you don't do, you not respond correct the question of the surgeon, if to do or not to do the blockage. There's another case after a fracture of the wrist. It's very interesting. After you take off the immobilization of the wrist, you can do thermography 3 weeks after, and you do the cold stress test. And with 3 weeks after, maybe 2 months, you can do a CRPS diagnosis with 2 months and a half. Only doing by this cold stress test. Okay, so some orthopedics are doing this routinely for patients that has pain after mobilization, after take off the mobilization. They wait 3 weeks. If they don't respond to medications, thermography, do thermography, positive or negative. If positive, for cold stress, blockage with 2 months and a half. If negative, looking for other problems in clinical medication. For children, this sometimes you can confuse. This is a case of child abuse. It has trauma on the hands, and the feet. There are situations that can mimic CRPS also. Vascular trauma sometimes could be mimicked also too. And during the cold stress test, some patients can respond with increase in temperature, for example, in the legs, like in this case. This is a woman with fibromyalgia sign, okay, and osteoarthritis of knee, but we decided to do the cold stress, but she didn't have hypothermia on the limb, but we did the cold stress of the hands and observed that she had a positive cold stress. Wow. But she has no clinics of CRPS. What is this? So this is a pitfall. Patients with peripheral artery obstruction, atherosclerosis, can respond with hyperthermia. So there are some situations we must be careful also with the test. Okay, and this is a new test that is become much more interesting now. The cardiologists are starting to do this with much more frequency. That it's the infrared imaging after 2 minutes of compression of brachial artery. You put 2 minutes compression and release this compression, and you see that you 2 minutes. You monitor the temperature, okay, for 2 minutes. 5 minutes compression, so the hand become more cold. When the right hand is cold, and the other one becomes hot. And after 5 minutes, you stop the compression. You see the rebound response. This rebound response is related to nitric oxides. If he has a good nitric oxides production, he has a good vasodilatation, he has a low risk of low cardiovascular risk. So this is a very interesting test, and it's much more better than ergonomic stress tests, and it's better than calcium score tests, because it's effective if you have a high risk or low risk of cardiovascular disease. So I'd like to thanks again, saying that thermography, it's not only diagnosis, but it could be for treatment, monitor, prognosis, to adjunctive with clinic. It must be following criteria that we are establishing in 2010 at Fortaleza, some basic criteria, and published this in a book that you can find on the page of ICGMT, International Consensus Guidelines and for Medical Thermography, and that is being used by our Medical Legal Society Brazil and by the São Paulo University. And I would like to invite you, everybody, to our next meeting that will be on November 24th and 26th in Iguaçu Falls. It's a nice place, and I know that everybody will enjoy this. We hope that 300 professionals there in this meeting, and this is the website if you want to know more about this meeting. We'll be talking a lot of diabetic and vascular diseases and pain diseases, and only is a specific thermography international meeting, and our honored president is Professor Francis Hing, so he is inviting you, and Professor Manuel Jacobson is our neurosurgery chief, is also speaker in this meeting. We also have Dr. Jane Wang from Singapore. You talk about breast cancer. Dr. Lin Chi Yang from São Paulo. Professor Francisco Silva, legal medicine. Professor Luigi Laino and Aldo Di Carlo, they are dermatologists that work with thermography, will be with us. John Allen from England. Manish Barara, he is from the Department of Diabetic Food. From here, Professor David Armstrong. And Dr. Totozes from Greek. He works with endovascular thermography to study the hot plaques in catheterism. Alexander Gorbach, that work with cerebral cortical temperatures and surgical application of thermography. Dr. Timothy Cohen, that is here, are invited. Also, Professor James Mercer, that is actual president of European Thermology Society. All they are confirmed. Professor Marta Levander from Sweden. Kamayani, thank you to accept our invitation. And yesterday, Dr. Park said it will become, and it will be a pleasure to have you also in the meeting. And also Professor Arcangelo Merla, that studies stress, physiological stress and thermography. Professor Dong Zhang, that studies experimental thermography in cats, cortical temperature, and Ricardo Vardasca from Portugal. He are the actual speakers for this meeting. So I would like to thanks again. It was a nice place to visit here in Greenville, and feel free to contact with me if anyone wants to any research and doubts about thermography. So thanks very much, and thank you.